Good afternoon and welcome to the public briefing for the COVID-19 response effort. I'm Brian Beam, Calcasieu Parish Administrator. We're going to have reports from a lot of our regulars today, updates on the numbers in terms of cases, and also we have some new information which we'll get to in a bit, but we're going to lead off today with Dick Grimion, Emergency Services Director.
Thank you, Brian. 3 areas I want to cover today. First is just a reminder of our personal hygiene. Wash your hands, cough into your elbow, and still maintain that 6-foot distance. In addition to that, the wearing of mask outdoors or when you're around other people is encouraged. It's not a substitute for the social distancing. Second thing is, this week the governor extended the stay-at-home order for another 2 weeks, as you know. We just wanted to cover the main 3 provisions that were talked about. As of May 1st, there are 3 major changes outlined by the governor in the new stay-at-home order. Number 1, malls will remain closed to the public, but stores may open for curbside delivery. Restaurants will be allowed to open their outside areas for patrons to eat meals only without table service. And last, all employees of a business who have contact with the public must wear a mask. The governor said that they will have some other announcements forthcoming, but that's the news that we have today. And the last thing I wanted to cover is today we're ending our first phase of our testing in the region. We've had the Burton test site open for a few weeks now. We tested around 450 people during the time that it was open. We will be moving to a new phase of testing next week that will be more in line with the national and state guidelines for increased testing. I'm going to ask Dr. Kavanaugh to comment on that during her part of this, but we think that it will increase the testing around the parish. I'll let Dr. Kavanaugh give the details.
In fact, why don't you just ask her to go ahead and start?
Yeah, Dr. Kavanaugh, if you could go ahead and start.
Hey, sure. Good afternoon, everybody. And I will cover some details about how testing could roll out across the region shortly, but I'll start with just the current numbers as we normally start with. And I just want to pause at this, that we now are getting reported over 3 million cases of COVID-19 across the globe. And when you think about the magnitude of 3 million people across this world that have gotten COVID, and some or that are now recovered, but it just really speaks volumes for the magnitude of this event. So as a state, for the state of Louisiana, we now have over 28,000 cases. We have 1,862 deaths. And you may have heard in the news this week that the death toll from this event has now actually surpassed the death toll from the hurricanes, Hurricane Katrina and Rita. So, so that's also kind of sobering when you think about it. We have, as a state, done 160,000 plus tests already, and the plan is going into May, we'd like to shoot for a goal of 200,000 tests across the state of Louisiana. New guidelines have suggested that more testing that we do, the better grip on this deadly disease that we will get, and the more information we'll have to move forward with what the infection rate is. As you know, if we can't provide testing to the community, then we don't really know exactly what we're facing, and we're fighting an invisible enemy. So testing is definitely going to be one of the next big pushes that we'll talk about. Here in Calcasieu, we have 389 confirmed cases with 29 deaths. Jeff Davis, we have 62 cases with 6 deaths. Allen Parish, 90 cases with 9 deaths. Beauregard, 39 cases and 3 deaths. And we know that Cameron's numbers, we're still having some difficulty making sure that all the folks from Cameron are actually being recorded in Cameron and not in Calcasieu because of some zip code and address level data problems. So definitely still seeing a slow increase of cases across this region. Definitely by no means have we had a huge spike of cases. It definitely seems to be sort of leveled off. And that is not just for the total case numbers, but also for our hospitalization data. So the number of people who are admitted with COVID symptoms to the hospital has remained pretty steady. Our hospitals, for the most part, stand ready and still have plenty of capacity to be able to care for COVID. They did resume doing some time-sensitive procedures this week, and as far as I have heard, that has gone relatively well, although we are still making sure that people who are receiving those procedures are screened for COVID, either by symptoms or potentially even by a test in some higher risk situations prior to surgery. So, kind of how that goes, we'll be looking to that as we move forward. So definitely the next big push is going to be to ramp up testing pretty substantially. And I want to reassure people that as we test more, we know that we are going to find more cases of COVID, because up until this point, we really haven't opened up testing widely. It's been a relatively strict criteria list. You had to have fever, you had to have a specific symptom of COVID like coughing, or have a high risk condition in some cases to even be tested. And really now the push is to move beyond that to a model of even potentially testing asymptomatic people that are close contacts of known positive cases. And so as we move forward with a new sort of mobile testing plan for the region, we were encouraging all of our hospitals, healthcare facilities, and also our mobile testing sites to really start to expand their testing criteria to be able to test more people as those supplies become available. The supply chain for tests are still not perfect, but every single week it seems to get a little better and a little better. So that's good. We expect to see more cases as we test more people. So what I do want to reassure people is that just because we detect more cases doesn't mean that everything's going to be shut down longer. I heard several comments of people who were concerned, well, I don't want to get tested because then I'm going to count as a number of a positive, and then we're going to have more cases, and then that might keep everything shut down longer. And in reality, the decisions that are made are much more complex than just the case numbers. Lots of different data points are being looked at, including the hospitalization data, including the number of people who are visiting doctors' offices with COVID-like illness, the same way that we monitor flu, and we actually track that. We've been tracking COVID-like illness. We've been tracking the percentage positivity, and so we are shooting for a large-scale testing effort, but with a low percentage positive. And so all of those data points are taken into consideration. So I don't want people to be afraid to get a test because it might count against us in some way. So just wanted to mention that. One new drug that has received a lot of press in the last 24 to 48 hours, an antiviral called remdesivir, that's an IV medicine that there has been a fairly large scale study that showed that it could reduce days of hospitalization, which is encouraging. But this medicine is very expensive. It's an IV medicine. There are a lot of logistical issues. So it's certainly promising. The actual data article is not out yet, but I look forward to seeing what that has to hold this week as we get more information about that study that was done. So looking forward to that. I'd also liked on testing point to mention that we are still seeing a large number of these antibody tests rolling out. So these are rapid tests that are done at the bedside, and many of them have not a whole bunch of data to say that they're good tests. I have seen them floating around the community. And so I want people to be aware that if they're getting tested for COVID, that if they're symptomatic, the best test is going to be a PCR test. There are some rapid PCR tests that are available, but I encourage you that if you're receiving a test somewhere, to ask what kind of test it is, and know that tests for immunity, which are the antibody tests, there are a few that are starting to come out that have some good data, but a lot of them are cross-reacting with common cold coronaviruses. And so they're not specific enough to know if you really have COVID. And even if you're positive, as if you had it, we don't really know if that means you're immune. And so we don't feel like they're all that useful at this point in time, but hope that eventually they'll be able to paint a good picture of who all within our community is immune. I also like to just reinforce the things that we've been talking about wearing a mask if you're in public. Remember, it's the courteous thing to do. It doesn't protect you from getting the virus, but it protects you from being somebody who spreads it to someone else who could suffer potentially severe consequences from the virus. We are not recommending glove use for the general public because we are concerned that that may stop people from washing their hands as often and could actually provide more harm than good. And I know everybody's tired. I'm tired too, we all are. But I also want to remind us that that we can't underestimate the risk of this. I mean, when you add up those numbers of how many people have died here in our community, we're not quite to, but we're near and on close to 50. And you got to think about that. That's just been over 5 weeks. And that's with all of the measures that have been in place for the past month. And so this is definitely a real threat. It is a virus that has already hurt a lot of people, and we still don't know a lot about it. People ask questions all the time. So what happens if I get it and I recover? Could I have long-standing health consequences from this virus? And the answer to that is we don't really know. We don't really know a lot about it at all, really, in comparison to what we know about many of the common threats. And we know a lot more about it today than we knew a month ago, but there are still so many answered questions. And I just want to remind people that this is just an unprecedented threat, and it is very real. So I'd like to leave it at that and answer any questions.
Is there a mechanism in place locally to match up those who have had COVID-19 with perhaps others who need their plasma or something?
I have not heard of any specific matching efforts, but I do know that plasma donations are happening. I actually know someone who did one this week, and I know our local hospitals are using them. And so I think that those processes are starting to be built as some people in our community build immunity. So I think that those sorts of things are going to come.
Do you need people who have had it who were perhaps not hospitalized or whatever to I don't know, notify any kind of central source on this or something?
I'm sorry, I didn't quite understand the question. Can you one more time?
Sure. If someone had it but perhaps was not hospitalized, is it necessary for them to, I don't know, register or report, that they have had it and recovered from it in order to be in a position to perhaps donate?
So I think that the blood donation labs are actually sending off some testing to try to determine immunity. I'm not sure. We would have to speak specifically to that donation center to find out what their process is. And I'm sure that it may differ a little bit from place to place. I do know that some people are being asked to provide their positive test and then their negative test. But I think there may be another layer of screening in there. So unfortunately, I don't have a specific answer for you.
All right, thank you, Dr. Kavanaugh. Just to repeat one of our main points, the amount of testing is going to increase in the near future and will be open to a broader range of folks. And just as important, there's going to be more locations, primarily through a new phase of this where there's going to be some mobile sites that can reach a lot of folks, especially in some of your outer areas that maybe are a little less populous. So there's a lot of good news on that front. We're going to switch.
Actually, if it's not too late, I have one more point.
Sure,
on that.
go ahead.
About the testing sites that I forgot to mention is that they should come with no cost associated, because we don't want any barriers to people getting tested that need to be tested. So they will be no cost, and they will also be mobile, so we can move them to communities that are needing to be tested or where testing resources are more limited.
Dr. Kavanaugh, do you know which day they're going to announce the details of all of this?
I don't. I know we've had some preliminary discussions about launching some of these sites next week, but I will defer to Dick and Paul on the details.
We will be announcing Monday the locations. As Dr. Kavanaugh said, we do now have the ability to move around. The barrier to a lot of this testing has been, having the symptoms and things like that. So Dr. Kavanaugh may want to comment on this, but now if you're 18 years of age or older, you'll be eligible to get a test. And this is part, like I said, is part of the national and state strategy to roll out even more testing. So Dr. Kavanaugh, I don't know if you have any comment on that.
Right, and that is correct. So that we're encouraging people who have any symptom of COVID or that could be COVID, or anybody who's a close contact of someone who tested positive for COVID to get tested. And so there will not be any screening above the age of 18, but those are the target groups.
Below the age of 18, I believe, Dr. Kavanaugh, is that correct?
I think we decided on 16.
Okay.
16 and up.
We'll be announcing all of this on Monday.
All right, we're going to hear from a couple elected officials. We have another good piece of news today that involves some help for the business community. I'm going to ask President of the Police Jury, Tony Gilry, to mention that.
Thank you, Mr. Beam. On behalf of the Calcasieu Parish Police Jury, I want to encourage everyone to please stay home as much as possible, practice social distancing, and also please wear a mask when in public. And also on your mask and gloves, please do not just throw them on the ground. I'm asking this of you. Doing these simple things will help keep our community as safe as possible. These simple things will also get our community to a good point and to allow us to reopen our economy. To help businesses prepare for that are allowed to open, and to help those eventually to open, we have a plan to get masks to businesses that need them. And right now, I'd like to call on Mr. Dane Boland, Assistant Parish Administrator.
Thank you, President Gilry. I also want to thank the Haynes Corporation for donating the masks that we have a plan to distribute to the parish. These masks are non-surgical masks. They're cotton, and the good thing about them is they can be washed several times and be reused. Many of us know on Monday, the governor revised the stay-at-home order by stating, I'm going to read this, all employees of businesses that are eligible to be open and who have contact with the public must wear a mask at all times. So in partnership with the area chambers of commerce, we have set forth a plan to distribute these masks to area businesses to include restaurants, faith-based organizations, financial institutions, nonprofits, and just folks who really are having a tough time getting masks, these businesses. So beginning tomorrow at 8 o'clock a.m., you may contact the police jury at 721-4027, at 721-4027, or you can make requests by email at recoverymask@calcasiewparish.gov. That's recoverymask@calcasiewparish.gov. These masks will be handed out on May 8th at 2 locations across the parish. One, the Seed Center, Southwest Louisiana at 4310 Ryan Street. The other at the West Cal Event Center at 401 Arena Road, Sulphur, Louisiana. I'd also ask everyone that for further details regarding submitting requests or picking up these masks, please review the press release that will be going shortly out today. Thank you. Any questions?
So these masks will not be given out to the public as such? I mean, do the businesses need a few extra masks to put on people who patronize their businesses?
That's a great question. What we try to do, Teresa, is prioritize how we give out these masks. So number one, we want to make sure the businesses in the community have what they need to reopen the businesses. After that, we can looking at general public, and if and when we can do that, we'll definitely come out with a statement on that.
That's very good news, and again, we want to encourage businesses following the information in that press release, which will come out. It's very important to register for that ahead of time so that the day of distribution, that's all prepared to where people simply just go and pick them up. So we ask people to please stay tuned on that one. We now want to hear from City of Lake Charles Mayor Nick Hunter.
Thank you, Brian. Good afternoon, everyone. Sometimes when we participate in these press conferences, I speak and will speak with kind of the voice of all of the mayors in Calcasieu Parish. I'm not saying that I'm not doing that right now, but I want to premise some of my statements to say that these are my opinions, Nick Hunter, Mayor of Lake Charles. And I think that Dr. Kavanaugh did a great job just now of reminding us about the severity of the situation. I also believe that sometimes the public wants elected officials to be either all one way or all another way. And I think it's a good reminder for us to just pause for a moment and realize that it is absolutely possible to care about the safety and the welfare of our citizens, and also realize that lives have been lost during this pandemic. And also, at the same time, believe that we have got to get to a point where we gradually reopen this economy. And I just want to take a moment again to restate a few things I've said. With the governor's decision on Monday, that did catch me personally by surprise. I thought that the governor would allow more of a regional opening in some corners of the state. When you look at our numbers here in Southwest Louisiana, we have fared far better than other parts of the state. He chose not to go in that direction. I also want to say that I voiced my opinions to the governor himself over this past weekend before he made his decision. I also voiced my thoughts to members of his administration and members of the Resiliency Task Force. And so right now, what we are doing as local elected officials is we are kind of dealing with the governor's decision. I do not have the authority to override the governor. And I just want to say that one more time and really try and hit that point home as much as I can to locals. I do not have the authority as mayor of Lake Charles to override the governor. The governor has also made it crystal clear that locals have the ability to be more restrictive if we want to. By the way, in Southwest Louisiana, we have not done that. We have lived by the governor's executive order. We have not been more restrictive. He also made it crystal clear that we cannot be less restrictive. So once again, locals can be more restrictive, but they cannot be less restrictive. I absolutely believe that this pandemic is serious in nature, but I also believe that Southwest Louisiana is ready to have a gradual reopening of our economy, taking as many precautions and taking the safety and the welfare of our citizens seriously. And as soon as the state of Louisiana allows us to do that, I can tell you that the city of Lake Charles will be ready. And I'll answer any questions if there are any.
just wanted to ask.
Probably people are getting mixed messages with, the disagreement as far as what the governor did. And I just wondered how concerned you are about that and whether you're seeing people do anything that you think is going too far as relaxing what's currently in place, as far as social distancing and that sort of thing.
I'm not sure if I understand the question, Teresa. Are you asking about locals?
Yes. Do you see people doing things in this community that you think are going too far as keeping COVID-19 in check?
No, I don't. I think people can make up their own minds about what they want to do and how, how they choose to react to this. And if some people choose to isolate themselves at home, then that's their choice to do it. And if they're a member of the vulnerable population and they choose not to exit the house and not to patronize even businesses that are allowed to open, I think that's within their right to do it. Absolutely.
I guess what I meant is, how concerned are you about people who are doing the opposite, who are tired of this and are basically not following the recommendations that have been given?
Okay, I see what you're saying. Well, let me say this. From a legal standpoint, from a governmental standpoint, I guess I'll repeat what I said a moment ago. I can't override what the governor has done, but I understand the frustration of people that have felt as if they have been cooped up for many weeks throughout this. I understand those frustrations, and I'm encouraging unity as much as possible. But I have not seen anything locally that has caused me to feel like there is any major concern or major cause for concern. I believe the people of Southwest Louisiana have weathered this storm very well so far. We are a resilient population, but I think we also have the ability to be very careful and cautious and take care of our health and safety, while at the same time eventually go on about living our lives.
All right, thank you, Mayor. Our last speaker today, before any questions, wrap-up questions, is Sheriff Tony Mancuso.
Good afternoon. Same with me in respect to the mayor's comments too. I think I'm amazed at the cooperation that we have had, not just with amongst public officials, but the public. I really believe did, as they always do, their job in adhering as best they can with, look at our churches, our faith-based groups that have not held services, and just I could go on and on about how we adhered to the protocols of the governor. And I think we were all caught a little off guard about not opening up a little more and somewhat. But regardless of whether we agree with that or whether we don't, we have a couple more weeks of this, and we're going to make the best that we can out of it, and we're going to deal with it as we always do. And I know that people are getting frustrated. Again, crime-wise, we're doing very, very well. We're still seeing the low call volumes, and although we still have obviously crime, and when you watch the news, we're making arrests. We're still doing our job that we're paid to do out there. But thank goodness it could have been, in my opinion, much worse given the circumstances, and it has not been. So things seem to be on the uptick as far as people's attitudes and their feelings towards what we've gone through. So I just ask and encourage people to continue this. Again, 2 more weeks. Hopefully at that point we will get better news, and I'm pretty optimistic, as I'm sure most of us are, that will happen. But I do think that it obviously is in the best interest of our public. I don't think the decision he made, although we're wishing it had been a little different for our region, I'm sure a heavy heart and thoughts went into that process. So I'm not going to undermine that or second guess that. We're going to deal with it as we always do as a community, and we're going to make the best of it that we can. But I am pleased to say, again, I'm so proud of our community in the way that we've conducted ourselves in the manner that we have, because we really have had minimal problems in the big picture. So, and I know that Stitch and I both on a daily basis communicate with our chiefs. Chief Caldwell from the city was at my office this morning at 6:30, and we discussed some things. And so, we are all on the same page and working through this process from a law enforcement standpoint. Certainly, this virus is not our wheelhouse, and we relied so much on our medical professionals, and we thank them from the bottom of our hearts. So, Teresa, I don't know if you have any questions, but that's it, Brian. That's all I have.
This isn't necessarily for the sheriff, but somebody is asking for clarification as to whether citizens are required to wear masks or not. I think it's just a recommendation from the CDC, but can anyone clarify that?
I think I'm going to ask Dr. Kavanaugh to clarify whether it's I think effective May 1st, there was a difference that Dick mentioned about employees. I know that's not what you're asking. Employees on any businesses that are open who are public facing, public in contact, have to wear one. The general public going out, just a citizen going out into the public, can you clarify that, Dr. Kavanaugh?
It's a recommendation for the general public, not a requirement. I think you're right. It's only a requirement for employees who are working in those essential businesses.
That's it.
No other questions?
I'm sure I'm forgetting something, but that's it.
Well, in listening to the different speakers and the questions that have come up, we want to encourage anybody, especially business owners, please contact the governor's office for any clarifications on their rules. It is definitely confusing because this is a confusing time. You have essential services, some that are deemed non-essential, but even the non-essential ones can open under certain requirements that have to be followed. So if you see a similar type business that you may think that's non-essential, there's another type business, but it's another company. One's open, one's not. How is that? That's because a lot of that is left to that business whether they want to open. The key is if they open, they've got to follow this list of guidelines put out by the state health and the governor's executive orders, and that's why you're seeing it. So I really appreciate the comments from all of our elected officials, including the sheriff, about needing to reopen, but honoring and following what the state and specifically the governor through his executive orders have laid out. Local authorities are not in a position to interpret that and rule on it. We simply have to follow those as best we can, and the citizens have done great here. I totally agree with all those thoughts. That does wrap up our briefing for today. We will continue these, so next Thursday, May 7th at 2 p.m. will be the next public briefing. Please, I'm asking the public to look for the news announcements on the testing site, developments that are going to be different after today, and also for businesses to look for our news release from the parish regarding mask distribution. Please go to the phone or email provided.
We just got one more question from somebody who wants to know if the movies will be open yet.
Will the movies be open? I have not heard that, but I don't know, honestly. Not as of now. I'll say that because, I mean, this is maybe obvious, but because the governor extended his stay-at-home order through May 15th, he clearly will have to announce prior to that what the plan is after May 15th. So I think that might be the next time you see some differences in the what can be open and what can't. But until then, we'll wait and see. And we appreciate everybody tuning in.